Welcome everyone to the Stanford Healthcare Design Challenge Pitch Day. We're so excited to welcome you here and show what we've been working on and what the students have been preparing for this day. We're going to quickly go over the context of the challenge for people that haven't heard of us before today. We'll have an hour of the first half of student pitches. The second half of pitches, so another 6 teams. We'll have space for the judges to deliberate and partner spotlights for everyone that's been involved in this challenge. And then we'll announce the winners by the end of this 3-hour Zoom. So my name is Julia. I'm one of the organizers of the Stanford Healthcare Design Challenge. And along with Longsha and a few others here, we've had this experience of winning healthcare pitch competitions and then experiencing a cliff as soon as you finish, and the lack of continuity and support after this intense competition period. While our personal entrepreneurship journeys didn't end after those competitions, we aim to create a new format of competition that intentionally supports students to continue with their ideas in the real world afterwards. So we started by designing a fully virtual experience where anyone could join in and learn from the high caliber of thought leaders that we can reach as Stanford students. We had speakers like Dr. Matthew Longren from Microsoft, FDA digital health specialist Sebastian Jairaj, startup founders, venture capitalists. Actually, combined between all of the mentors, speakers, we have over 100,000 LinkedIn followers amongst everyone. So the idea for this was for us to democratize the knowledge, the access to ask these speakers questions, and then put together a curated advisory board to support the students after the competition. Click. Our prompt for this year was around social determinants of health. And we wanted a problem that students of all levels and locations could find accessible rather than a niche clinical challenge for those affiliated with an academic medical center. We asked students to focus on specific patient populations with social determinants of health problems, and then propose ways to engage them and measure that outcome. To level set a little bit, we wanted to find students interested in healthcare innovation that may not have been exposed to a lot of the topics we're covering, and not just accept students from brand name institutions like Stanford. So our criteria actually focus 80% on the team's interest in the problem, why they care about it, and then only 20% on the actual ideas that they were proposing at the application stage. Out of hundreds of students that applied, we accepted 12 teams, which was a total of about 50 students, to participate in this recent phase of the challenge, was about 2 weeks. We have East to West Coast represented, we have undergrads to PhDs, and in this phase of the challenge, our team was hands-on to personalized support with multiple rounds of feedback throughout the challenge. In these 2 weeks, they were developing their ideas from their original proposal, and we emphasized 3 key points. We wanted to have the students understand a buyer point of view to share their value proposition, understand potential data strategy and what data would support the outcomes they were saying. And then healthcare is very personal. So how can they engage people to care about a problem that they care about with storytelling? Of course, we want to thank all of the mentors that volunteered their time to support the teams. We bolded people that went especially above and beyond and had multiple sessions in these past 2 weeks. Oh, sorry. So presenting the inaugural cohort of the Stanford Healthcare Design Challenge 2024. We have a range of projects across a lot of different areas of interest, and you'll hear from them very shortly after a brief introduction of all the judges on the call today. So if we could, we're so grateful that everyone can be here virtually, and we're representing a broad range of perspectives on healthcare implementation, from health system to payer, from technology platforms to policymakers. I'd like you all to unmute, and in the order of this slide, from Pamela, then Scott, then Todd, and so on, please briefly say your name and your organization so you can come to the front of the Zoom.
Of course. I'm Pamela Garman Johnson. I serve as the National Senior Vice President of Healthy Living and Next Gen Programs at the American Heart Association. Glad to be here.
Thank you.
Hi, Scott Jocelyn, Chief Innovation Officer for UCI Health. I've been a Chief Information Officer in health for a very long time at PharmD by training, and I oversee our venture capital program at UC Irvine.
Good morning. I'm Todd Ferris. I'm the Chief Technology Officer focusing on research and education at Stanford Medicine. Thanks for having me.
Hi, Hi, this is Dr. Manish Sharma. I'm the Senior Medical Director for Promise Health Plan Blue Shield of California. I work at the intersection of policy, clinical care design, delivery, and social and structural impacts on health.
Hey, good morning. This is Anurang Revri. I'm Chief Enterprise Architect at Stanford Medicine. I'm responsible for architecture, interoperability, and AI technologies. Glad to be here.
My name is Faye Sahai, founding managing general partner at Velocity Ventures and 30 years in healthcare, and I've run Kaiser Permanente's innovation labs and funds and worked at Blue Shield as well at Deloitte Health and a few of my own startups. So great to be here.
Thank you. Troy.
Hello, everyone. This is Troy Tasbas. I'm the Director for Digital Health Center of Excellence at the U.S. Food and Drug Administration. Great to be here.
Thank you.
Hi, everyone. I'm Neil Malawid. I am the Director of Market Research, Data Analytics, and Pricing Strategy here at InterSystems. Happy to be here. Happy to InterSystems is partially sponsoring this, and looking forward to the pitches. So thank you.
Good morning. I'm John Gorman from Nightingale Partners here in Washington, D.C. We invest in early stage social determinants of health companies and then structure social health interventions with health plans in Medicare Advantage and in Medicaid. Very pleased to be here. Thanks for having me.
Before we announce the winners, I just want to do a really quick closing remark. When Aditya and I first co-founded this concept, we had one core theme, which was we wanted to redesign the paradigm for how academic competitions are done. Because so much of it is just focused on an academic resume building. Nothing is really focused on supporting students if they have passionate ideas long-term. And hence, what we hope that this competition can inspire is a future framework for how we think about academic competitions, where it's not just students come in with their predisposed knowledge and then they build something for a day or a week, and that's it. What we really want to encourage is this thought process that in order to really support longevity in ideas, we create an entire program around it. We create an entire community around it. We bring in the stakeholders who matter and from every walk of life. And I think, and I hope that each of y'all are as inspired as I was throughout this entire competition, because many of these teams have been building these ideas for less than 2 weeks. And look at how far they've already come. And look at how far they can go still. And this is just something that wouldn't have been possible without a team to support. And this is the best team I could have ever imagined to be part of this inaugural organizing committee. And especially big thanks to Julia. You've heard her so many different times throughout this competition, moderating all these sessions. I literally couldn't imagine doing this without Julia. So Julia, thank you so much. And equally to every single person on my team, Aditya, Kosh, Richa, David, Sherry, Aurora, Katrina, Wenming, Rafat, and Ishan. They have made this happen. Our initiative that had reached over 1,000 different people have been literally just these 12 people, and just special word of thanks there. So what's next, right? Firstly, for the winning team, it's not the end of the road for you. We will be supporting you for 3 months afterwards with advisory boards, with additional stipends, with additional partnership connections. We are also publishing an impact report about how we created this design challenge such that it can be reproduced by anyone and anywhere. And follow us on LinkedIn, because we're going to keep on growing this vision. And especially our goal for next year is a global vision. We want to support any student from any university anywhere. This year we had only done the US, but there's so much more work to be done on an international scene. And that's our vision in terms of the next year, that we want to support an international healthcare challenge. And any support from the community would be greatly appreciated. And likewise, it doesn't need to be just siloed in healthcare. We can create one in climate tech. We can create one in fintech. There's a lot of different potential for us to take this such that we can support students and their own personal journeys. So we would love to invite each and every one of you to join us in this future mission. We have a QR code here that is a brief survey link that allows us to follow up with you after this event. But whether it's a sponsorship or mentorship or being part of our organizing team, being a partner with us, being a speaker, or being an advisor, we love to have you on board. And thank you so much for being here today.